Hello, I'm Troy Parker, President of Innovative Labor and Cleaning. This is another Mental Health Monday. I wanted to do a series on depression and some tips over the next several weeks on dealing with depression. But first, I wanted to go over some signs of depression and some myths about depression. Some common signs that either yourself or someone you know could be struggling with depression are as follows. Lack of interest in activities that normally were of high interest or you truly enjoy doing. Now, this can also be associating with certain people, maybe family members or good friends. If you might feel like you don't want to maybe be around them, or you might see a friend or coworker or a family member that they used to come around often, but now they're kind of like, closed off and you don't see them as much, this could be a sign. If some of these other signs that I'm going to go over with you are also present, it could show that maybe they're struggling with something. Next, a lack of motivation. Sometimes a person who deals with depression will just feel like they're just not motivated. They can't really get much done. There's also either oversleeping. You'll hear the person speak about not being able to get out of bed. And there's also not being able to sleep. Maybe going to bed and constantly just toss and turn, but they can't settle down and get to sleep. Another common sign is lack of concentration. You might feel that you're at work and you're trying to concentrate on a project, or you might see a friend or family member who is trying to do something that normally they could get done in a quick and short period of time. You'll see them constantly, leaving the task, coming back to it, or taking long periods of time to get things done that normally didn't take long at all. Feelings of sadness and hopelessness. If you hear a person talk about a lot of sadness, or they seem like they don't have much hope, this can also be a sign. Also, they could deal with anger or irritable moments. And then, of course, there's thoughts of hurting themselves or suicide. Now, these are some common signs that you could look for in yourself if you feel you might be dealing with depression, or in someone that you might be around. It could be a coworker, like I said, or a friend or family member. There's also some myths I would like to go over about depression that people many times get misconstrued. One of the myths that is common is that depression is all in your head. You will see people say things like, get over it, it's all in your head. Well, part of that may be true. Keep in mind, depression is a psychological, social, and biological disorder. So it is not like a person can just snap out of it at the drop of a hat. Many times they may need some counseling or even medication to help them to manage their depression. Another myth is that it's hereditary. If a family member has depression, it could be a father, mother, grandmother, that you'll have it. This is not true. Science has shown that less than 15% of individuals who family members struggled with depression did have the same disorder. So don't feel that just because a family member, it could be a brother and sister, might struggle with depression, you will struggle with it also. Another myth is that depression is brought on by trauma. Now, many times a loss of a person or some traumatic event can bring on thoughts of sadness, but most of the time with a person who struggles with depression, it merely brings them and magnifies them. Most people will go through sadness at a loss of a loved one, but a person with depression will go through that period and it will last much longer. So there is a difference. Another myth is that only medication can help those who struggle with depression. While medication can be used, there's also cognitive behavioral therapy that can be used to help treat and manage depression. So it doesn't have to always be medication alone. Sometimes you might use a combination of both, or sometimes you can just use the therapy. Many times you'll also hear that only women struggle with depression. That is not true. Men struggle with depression also. But many times, especially in the Black community, men will not go get the help that they need, and they just deal with depression and try to self-medicate over time. I'll be honest with you. My father struggled with depression for years, but it wasn't until his death that we really looked back and saw that, hey, maybe he had been struggling with depression for some 20 years. he displayed many of the signs that I spoke of before: lack of motivation, oversleeping, not having interest in the normal things that he enjoyed doing. But as a child or a young adult, you're not skilled enough to say, hey, maybe my father's dealing with depression. And one of the biggest myths I would definitely like to clear up is that depression is a weakness. As I spoke about just before, or how in the African American community, many men will not go get help and treatment for depression. They'll just know something is wrong and continue on. And this is largely because they feel that any type of therapy or saying that they have depression is a weakness. And that is only because we have stigmatized it as a society. Depression is not a weakness. It is a chemical imbalance in many cases, and it is a true disorder. I share these things with you in the hope of clarifying some of the myths and spotting out some of the signs that you might look for in those loved ones, friends, co-workers that you could be around. Many times people could be struggling with something, and because they're dealing with it, they don't see it as you do. But sitting down with someone privately and asking them some simple questions might help you to help them see that, hey, maybe they need some outside help. And then getting that help can help them manage their life in a more productive way. By turning a blind eye to it, either yourself or if you see it in another person, only perpetuates the continual stigma that mental illness or depression is somehow a weakness and something to be ashamed of. If a person is able to get the help they truly need to manage their depression or whatever mental illness they could be struggling with, it will help them to live a more satisfying and productive life, and that helps all of our community to be stronger. I hope this video has helped you, and as always, remember, it's up to you to make your life matter.